Well, hello there, and welcome to another edition of Johnny Davis Live. We're here on this Friday, December 6th, 2019, with a special show for you today. Actually, we're going to have a double header. That's right. I say this holiday season. Hey, let's get into some really good subjects. On our first show, we're going to be speaking with Dr. John Lucas. This guy's profound. He has a lot of great information for not only just fighters, but athletes and just people in general. And today we're going to be talking about the common cold. So if you had some questions about the common cold and how do you get it and certain things that happen to your body and prevention and things like that, we are going to discuss that in the next 30, 45 minutes, maybe to an hour max. After that, on show number 2 today, we'll be speaking with Mr. Jerome Robinson about abduction safety, which is something kind of really near and dear to my heart, because as a parent, obviously, I have children, and obviously this is a lot of stuff going on with that. So we certainly want to have that conversation with Mr. Robinson at the 1 o'clock hour. So I hope you will join us. We always want to thank our sponsors, Blackout Fights at blackoutfights.com, for all they do for us, and Eastern Offset Printing for their support as well. We will be we're having a couple of tournaments this weekend. We got a tournament, IKEA PKB tournament in Durham, North Carolina tomorrow. We're in Pleasanton, California tomorrow, as well as San Diego, Carlsbad, California on tomorrow. So we have a lot going on. So I'm really excited to have that, being so busy with these events, and hope everybody will stay on board with us for that. So we're going to not waste any more time, if you will, and we're going to go right ahead and bring on the one and the only Dr. Lucas and have our conversation about the common cold. and Dr. Lucas, we know that a lot of people are doing the holiday shopping and everything right now. A lot of people are out there doing their thing. We have some people on, and we'll have some more people who'll be watching this. I want to get this on the record right now so that we can spread this message and information out to all of our, viewers who will come on and check out this show. But how have you been doing, sir?
Not too bad. How about yourself?
Good. Ironically, you said that it's interesting today that we are talking about the common cold, because you kind of have a cold today.
Yeah. Lucky me. I'm glad we're not talking about something more serious.
Right. That would be pretty bad. That would be pretty bad if you did. But I'm glad that you're overall okay and everything. And I think it's going to be really interesting for a lot of people about, some people, like particular fighters. We get colds often. I have a little sinus and stuff myself going on and all, but with the training and stuff that we do, we expose ourselves to heat and cold and different temperatures, and I think we might even, the athlete might even catch a cold more than maybe the average person. Is there any truth to that?
Yeah, there seems to be some truth to that, and it probably has a couple of components. One, I think the personality type that tends to be the athlete that trains hard tends to be the type of person who doesn't like taking days off. So when they get sick, they still go to the gym, much to the detriment of the other, 5, 6, 10, 15 guys and girls they're training with.
Right.
And then just the overall training intensity is likely an issue as well, especially athletes that have a competition coming up tend to be a little overtrained, or I think better said, under-recovered, which makes their immune system less likely to be able to fight off the virus or whatever, common cold or more serious infection than they would be if they were more adequately recovered. So those two things, having an increased chance of exposure and, more close body contact than the average person, plus possibly having their immune system be a little bit weakened because of being overtrained or under-recovered, kind of leads to them being sick a little bit more often than they would be otherwise.
So I want to break it down. I want to just get right to the nitty gritty of it. Tell me, what exactly is the common cold? What happens to your body when you get a common cold?
Yeah, so we talk about the common cold like it's a singular thing, and it really isn't.
Okay.
So that's the first thing, because one of the questions that people ask me a lot is, so if I got a cold once, how come I can keep getting a cold? Most
Right.
other illnesses, once you get it once, you have some sort of immunity towards it, and that probably holds with common colds as well, except that there's hundreds or really thousands of different types of viruses that cause the common cold. So there's rhinovirus and adenovirus and yada 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 virus. So each time you get a cold, subjectively, it seems like it's the same thing, but it's probably actually a different virus. Much like each year that people talk about the flu like it's a single thing, but it's a family of viruses, and each year it's a different strain of the flu virus that comes through, which is why you can get the flu multiple years in a row. So um, when you're experiencing a cold, your body's working on fighting off whatever respiratory virus it is that you've contracted, and it's mostly the body's response to the virus that causes the symptoms that we have. The congestion and the runny nose and the fever and that kind of stuff. The things that bother us are usually more related to the body's response to whatever virus than it is the actual attack of the virus itself.
Right. So I'm just kind of curious. So if you let's say that we are walking around and we're normal, okay, normal meaning body temperature, 98, whatever it is, your body temperature, you don't have any headaches or any kind of fevers or anything like that. So let's just say that that is normal. Okay. What happens to some of those things that then makes us sick? I mean, there's something that goes with the blood or something that happens with, I mean, the oxygen in your body. I mean, what is it?
Yeah, so it's just a matter of direct exposure to the virus. So most of the respiratory viruses need to get into your respiratory tract somehow. Usually by this, you reach up and touch your face or fix your glasses or whatever, and the virus that was on your hands now has access to your mucous membrane, so it gets into your body, and that's where the virus sort of, for lack of a better term, wants to be. So it starts replicating. And as it does that, your body's immune system realizes that something's not right, and it starts going into its defensive mode to try to fight that off. So it depends on the virus exactly what it is that happens to your body as a response to having it. But you can be perfectly healthy, like you were saying, and get a cold. You don't necessarily have to have something wrong with you or have some sort of specific link missing from your defense mechanism to contract the cold, although that might make it more likely.
Right, right. Well, this is kind of like, so I'm going to go into Johnny Davis' brain here, all right? And man, so a person, and we'll talk about this a little bit more, but I'm just trying to figure out, how do you actually get it? And we know we're talking about germs, and we'll get into that later. But if a person sneezes and they have a cold, can I imagine that the virus, those little particles or whatever they are that comes out of the sneeze, they are infected, and when I breathe them or either somehow touch them, it goes into my body. If we can imagine a bug literally going into our bodies and infecting us, is that the way we get the common cold?
That is exactly it.
Okay.
Both from direct exposure. So the disgusting circumstance where someone literally sneezes in your face, or somebody who has a cold is talking to you, or they sneeze and walk away, and the little respiratory virus mist that they left when they sneezed falls on doorknobs and tables and things like that. The virus is able to survive in that state for a period of time. So then when the next person comes and touches that with their hands, they now have the virus on their hands. And then when they reach up and touch one of their mucous membranes or around their face or things like that, that's what lets it get into your respiratory system. But you're exactly right. There is literally, the virus is a little protein thing or a little RNA strand that actually resides in those respiratory droplets or on inanimate surfaces that you touch and then introduce into your body, usually through some sort of contact with the mucous membrane, so your eyes, your nose, your mouth, or something like that.
Wow, that's pretty amazing. God, so interesting too. The when you get a cold, sometimes you get a cold in the summer, sometimes you get a cold in the winter. Now there seems like, and like I said, I know you said there are different variations of cold, but there seem to be, the effects of that cold seem to be a little bit different in the summertime than in the wintertime. Can you elaborate on that?
Yeah, a little bit. Like you said, there's different variations of the colds, and then the what's going on in the environment, I think, makes both the likelihood of getting a cold and the effects of the cold a little bit more significant in the wintertime. So, first off, some of the stuff that people attribute to colds in the summer is probably actually simply allergies. They
Ah,
get, the runny nose and feel bad, maybe have a low grade temperature for a week or so during the summer, and they say, "Oh, I got a cold." But what really is going on is whatever plant they happen to be allergic to happens to be releasing its pollen at that point in time. And then in the summertime, at least here in the South, it's a lot warmer. It's a lot more humid. You're a lot more likely to be outside getting fresh air. You're much less likely to spend significant amounts of time in places where the air is heated and therefore really, really dry. So, some of the effects of the cold, particularly the runny nose and the dry mucous membranes and changes with your voice and things like that, are sometimes not as significant during the summer. And then the types of viruses that typically cause the summer colds are often different than the viruses that cause the winter colds and tend not to be quite as virulent or not quite as severe when you actually get them.
right. Because I'm a little confused sometimes when I have sinuses. I know that, but I'm not always sick, if you will. I'm sick, but I'm not like my body feels okay. It's just my head is about to explode
Yeah.
because of the sinuses, especially more so in the wintertime. And also, I just kind of want to understand better the difference in that head cold and a cold more in your chest area. Can you tell me a little bit more about what is the difference in that?
Yeah, so the sort of sinus cold sort of thing is usually because of some sort of exposure that's just making the mucous membranes in your sinuses overactive. So they start getting a little bit swollen, which makes it more likely that the little orifice or little holes that attach the sinuses to your larger airways in your head get clogged up, and then you start getting pressure issues in your sinuses where the pressure in your sinus actually goes up, and that's what causes that sort of sinus headache that you get. Um, as opposed to the respiratory colds that are a little bit lower in the respiratory tract, so like bronchitis, bronchiolitis, or and more significantly pneumonia. It's literally the virus is attacking the mucous membranes lower in your respiratory tree. So those are the colds that typically give you that deep cough, cause the voice
Ah,
change, hard to breathe, give you that kind of burning sensation when you breathe sometimes. So
ah.
it's just a difference in either the location or in some cases the location and the type of virus that's causing the issue.
Right. So what happens when your body starts aching? You just literally it just starts aching. I mean, that's kind of one of the signs that you're starting to get sick. Is that something like water? You dehydrate? I mean, what is it?
Yeah, so it can be related to dehydration. It probably has more to do with just inflammation in general. So when
Ah,
your immune system gets kind of teed off and realizes that somebody's invading, you have a whole bunch of what they call inflammatory markers that you can look at in your bloodstream that tell you that your
ah,
body is producing things that result in inflammation. So the sort of achiness that you get throughout the muscles in your body is probably related to those inflammatory markers and mild inflammation of the muscles of the body. In some cases, that inflammation of the muscles can be significant enough that you actually will get muscle proteins leaking out into the bloodstream and get sort of a rhabdomyolysis sort of look where you can actually get mild muscle damage, or in some cases more severe muscle damage from that immune response. And
mhm.
then in some very unlucky folks, you can actually have your immune system, when it attacks the cold, the same substances that attack the actual cold virus will wind up attacking the heart muscle specifically. And there's a
Whoa!
phenomenon called post-viral myocarditis where you can get very severe heart dysfunction, usually that occurs right after a cold, that sometimes is transient, unfortunately, sometimes is permanent. And it was never anything outside the body that attacked the heart. It was the immune system's response to the virus just happened to also go after the heart muscle.
Wow. Wow, man, that's getting pretty heavy right there, Doc. But no, I really get it. I was just kind of wondering why that body aches that way. When you're starting to get down. We talked about the different kinds of colds, but what is that level of when you have a normal cold and then it turns into the flu? What what
Well,
what is the difference there?
so I mean, the flu is specifically a particular virus. So
Ah,
the common cold, like you're saying, is caused by a whole bunch of different kind of viruses, and then the flu is literally the influenza virus or a variant of the influenza virus. And
okay.
just like we said, the effect of different cold viruses can be different. The effects of the flu virus are typically more significant. So people who get the flu usually have higher fevers. They usually are more likely to have those muscle aches and headaches that sometimes go along with that. In certain individuals, the flu virus is a lot more likely to cause secondary problems like pneumonias and things like
Ah,
that. You're more likely to get you're more likely to feel worse with the flu than you would with the typical
ah,
cold.
ah.
So it just happens to be the effects of that particular strain of viruses.
And they've been able to recognize the flu as a certain strain and certain things that happen to you. And
Right.
all of those things are connected where you can kind of look at that person and say, hey, you have the exact same issues as this other person. So that it must be the same virus.
Yeah, so I mean, you can, and there's actually testing available now. So before we send people to heart surgery, particularly in the winter,
Ah,
it's not unusual for us to get a phone call, 8, 9, 10 days out saying, hey, little Johnny's got a runny nose. We want to know if it's okay for him to go to get his surgery, and we'll actually send them into the doctor. They can do what's called a respiratory pathogen panel that looks at adenovirus and parainfluenza virus and all the other cough and cold viruses to see if the person has has the immune response to one of those as a sign that they've got that sort of a virus. And they can do the same thing with influenza. So if the cold that I have now were more severe and I had a fever before I go to work, I would go to our the nurse practitioner that works at the hospital system for employee health and get a rapid flu test to see if I have the flu. Because if
right.
I do, you don't want me hanging around kids that just had heart surgery, but they can actually look to see if you have the influenza A or influenza B. And if that's positive, then you know that, yep, you've got the flu and therefore could potentially give it to other folks. Versus if it's negative, it means, it doesn't mean you're not sick. It just means you don't have influenza. So your risk to other people's less than it would be if you had the actual flu virus.
So that brings me to the question about fevers, because you mentioned it just now. So is it the fever? Is that the telltale sign, if you will, that says you're now contagious? That whatever your body temperature, whatever, has gone to a level when you can now pass this on to someone?
No, the fever is actually just part of the body's immune response. By getting warmer, it tries to make the body less hospitable to the virus, and it makes the immune system work a little bit better. But that doesn't necessarily give you any indication of when you may or may not be contagious. In fact,
Ah,
most people are contagious before they get symptoms, and that's one of the reasons why uh, the both influenza and the regular sort of common cold viruses are such a problem, because you can spread them around for a day or so before you start really feeling sick yourself.
so why is it that when people say, "Do you have a fever?" If you got a fever, don't come to work today. I mean, it's always that fever has been, do it with the back of your hand and all that. That fever has always been that seemed like that barometer to say whether you can be around other people.
Yeah, well, it's sort of. I mean, that's kind of an old wives' tale, and
Okay.
I don't mean that pejoratively, because like a lot of those, sort of traditional markers, it's definitely true that if you have a fever, you probably don't need to be going around other people because it's likely that you're actually sick. A lot of that has to do with trying to figure out whether your, 9-year-old who says, "Oh, I'm sick, I can't go to school today," whether there's any evidence to support that they're actually sick, or whether they're just, not wanting to go take their science test or whatever. So having a fever would definitely be a sign that you're contagious, but it's not that the fever makes you contagious. It just means that if you have a fever, you've got some sort of an illness that would likely be contagious, if that makes any sense. So it's
No, it does. It makes a lot of sense. Now, hey, here's a good one for you. Look, I will do this for the sake of just I know people are probably turning off right now, but I did that for a reason, right? Because that congestion, which I do have right now,
yep.
and the snot, if you will, up in your nose. I mean, people hate to hear it. They hate to hear you coughing it up. They hate to see you blowing your nose, right? So
Mhm.
I want to kind of break it down a little bit. First of all, what is snot?
I'm tempted to produce a sample.
Oh, come on, because as you said, you're a little sick right now. I just wanted to produce a
No,
sample
so
and just show it to everybody.
so that stuff is it's literally mucus that your body produces, that when we talk about like the mucous membranes,
Yes.
they're called mucous membranes because their ability to create mucus, which is a liquid that has proteins in it, and then what actually is in that varies. So I mean, as you know, as your illness progresses, the color of that stuff often changes,
Right.
and sometimes, and the color is not, that's one of the other sort of uh, old wives' tale, is you can tell whether you have a bacterial sinus infection versus not by the color of the mucus, and that's not entirely true. But you'll see that the color of that often changes throughout your illness. So a lot of times it starts off clear and then kind of turns this sort of whitish color, which the whitish is literally white blood cells and other inflammatory things that your body's producing, trying to get rid of the infection that's there. And then as you start feeling better, it
Mm.
oftentimes kind of turns back clear and gets really runny again, which is the way that the normal production of your mucous membranes is supposed to look. It's supposed to be kind of watery and thin. So it's sort of a sign that you're heading in the right direction. So that's all that is. It's just stuff that is produced in the goblet cells and the other cells in your mucous membranes to try to keep those mucous membranes lubricated. And the stuff that you feel up here in your nose versus the stuff that you feel in your lungs when you have congestion, lower, is basically the same stuff. And in a lot of cases, especially when your primary symptoms are sinus kind of symptoms, the stuff you cough up first thing in the morning is actually postnasal drip. So it's stuff that
Oh,
sinuses, and while you're sleeping it literally leaks down the back of your throat and sits in your larynx and your big airways, and then you stand up, take a breath, and your lungs kind of feel that irritation and you cough it up. That's one of the reasons why when you're getting sick, when you lay down at night, a lot of times you cough a lot worse while you're trying to fall asleep, because all the postnasal drip starts going down the back of your throat and irritating your airway.
okay. Here we go. So on that, now listen, I know people say, this is crazy, but I know you got to be learning about this stuff, and that's what we want. That's why we want to have the show. By the way, you're watching Johnny Davis live here, and we're speaking to fight doctor and pediatric cardiologist, Dr. John Lucas. He's out of Simpsonville, South Carolina. Okay, so what's best? And I've always wondered about this. When you cough up this phlegm or snot or congestion, is it better to spit it out or to swallow it? Because, and let me just say, in my mind, I got this weird philosophy that is better outside of why I don't drink and do drugs, all right? That is better outside of me than staying inside of me. So therefore, I always make an effort, even if I have to have a little cup or whatever, as I'm coughing it up, is to spit it out as opposed to just swallow it.
Yeah, so it probably, in the grand scheme of things, it probably doesn't make a huge difference. Getting rid of it entirely, getting it out of your body, is probably what's optimal, just because that way you don't have to worry at all about it.
Right.
It's just that, socially, depending on what you're doing, that might not be. Might not, if you're sitting and talking to your favorite pediatric cardiologist and all of a sudden you spit on the floor, you'd be like, okay. So I think that's what leads to the people that generally swallow it. But when you swallow that stuff, it's going into your stomach, which is very acidic. So you're probably going to kill anything that's in there, that's potentially dangerous. But people that have a lot of, especially sinus drainage, they notice sometimes when they swallow it, it makes them feel, especially a large amount of it, it starts making them feel a little sick to their stomach.
Yes.
So I generally would say it's probably better to get rid of it entirely if you can, especially if you're homesick. Spit it into a Kleenex and throw it away, whatever. But it's probably not going to be a major determining factor how long you stay sick one way or the other.
Okay, so I will spit mine out. I could almost give you an example right now, but we'll move on. One of the things about when you're in a fighter, like I said, we cover up, we sweat a lot. Is there such a thing as sweating out a cold? Because people have always said that. And listen, when I had a cold and I would put on all this stuff and I would work out, I felt better afterwards.
Yeah, so absolutely. I was about to say the same thing. From personal experience, when I'm sick, but not so sick that I feel like I can't go to the gym, or I can't work out, I always feel better if I get a sweat going and get a decent workout. But that's probably pretty temporary because you get the blood flowing, you get your airways opening up because you're working and whatnot. And it thins your mucus out, so you feel better for a short period of time. But especially if you work out really hard and stress yourself to the point where you may be impeding your immune system's ability to do its thing, you may be leading yourself into problems as far as the illness lasting longer, being more likely to get another cold right on top of the one that you have. There's not any good evidence that you can truly sweat out a cold and make it go away, but you can definitely temporarily make yourself feel better by raising your body temperature for a period of time. I think it probably does a lot of the same things. One of the things that a lot of folks like to do when they get congested is hop in a hot shower and, turn the water as hot as you can stand it and stand in there and breathe in the mist. And that kind of does the same thing. It helps hydrate the mucus in your airways. It makes your blood vessels open up, gets the blood flowing, tends to make your airways open up a little bit, and you feel better while you're in the shower and for a while later. But then a couple of hours later, you kind of trend back towards where you were. So I think you probably get the same thing or the same effect either way. So the short answer to your question is probably not. However, that physical activity or application of heat and steam can be helpful in mitigating your symptoms, at least temporarily.
That makes a lot of sense, though. It certainly makes me feel better when I do it and all.
Just when you go to do that when you're sick, just work out by yourself. Don't grab your.
Right. Yeah. Well, that makes sense, right? Because I'm sure that's let's just make it worse for somebody else in particular. My mama always used to tell me, hey, when you go outside and it's cold, you need to put a hat on, you need to wear gloves, you need to wear shoes. But then I see people sometimes that they don't wear anything. They just go out there and they're fine. And I don't know if there's some cultural differences in that, some environmental differences in that, or our immune system or whatever it is. But is there any truth to the fact that we need that? Why do we wear gloves, hats, and caps when it's cold outside?
Yeah, I mean, for comfort. There's not any good evidence that bundling up makes you less likely to get sick, with the potential exception of if you really are underdressed and get not just cold like I feel cold, but cold like you start making your actual body temperature go down a little bit, tending towards hypothermia, then that can definitely increase your likelihood of getting an illness because your body's busy dealing with that problem. But in general, the folks that bundle up versus folks that don't, or like going out, the big thing my parents were, and a lot of parents growing up, don't ever go outside with wet hair. And I grew up where it actually gets cold, not South Carolina, but upstate New York, where it's 0 degrees or colder quite frequently. And you wake up in the morning, take a quick shower, and go outside. Is your hair still wet? And you're like,
right.
Well, then you need to dry it. So, but it ends up being just basically comfort. There's not really any good evidence at all that doing things like that, especially for short exposures, like running from your house to your car, out to the school bus or things like that, having a wet head for a couple of minutes outside or going out and hanging out outside without a hat on or not wearing gloves is not likely to make you much more likely to make you get sick.
Right. But obviously you suggest probably that we do wear cap and hat and.
Yeah, I mean,
I guess if you're cold, you want to be warm, right?
Exactly right. Yeah, there's nothing. I don't know if you know who Wim Hof is, the guy that advocates, going into ice baths for long periods of time and things like that. I'm not a huge advocate of making myself uncomfortable by being overly cold. So you're not likely, there's a reason why I moved to South Carolina and not the North Pole. So I will usually have a hat on when it's cool outside and wear gloves and things like that. But like I said, it's largely just for comfort so that I can concentrate on what I want to do and not sit outside thinking, my God, I'm uncomfortable. This is terrible. Why am I so cold?
Right.
Whereas I have some friends that just never seem to be cold. I'll be standing there talking to them with a Carhartt jacket with a wool cap and a hood on and gloves, and they're wearing shorts and a T-shirt. And the whole time we're talking, all I'm thinking is, there's got to be something wrong between this guy's ears because he's tolerating this 25-degree temperature with nothing on. But you don't see folks that do that get sick a lot more frequently than the folks that bundled up.
Yeah. And that's just kind of weird to me. That was very good, very good. The other thing about getting a cold with me, I have this weird thing. I guess I'm weird. I keep saying I have weird things that I do, But and this has worked for me over the last few years. I just, as a reference point, I was a very sick child. Okay. I was very asthmatic. And I was actually so bad that I was in a tent. A lot of people don't know that. So I guess if you start kind of looking at my story, it might become a little bit more interesting. And here was this child that had asthma so bad that I was in a tent for weeks, right, as a youth. And I could not, I had to live in a tent. I was a tent baby. I guess that's what you called them back in the day. And then grew up to be, whatever I became in the fight world, okay? But one of the things I do today, I used to get sick. I mean, sick to the point where I would have to be in the bed like every year. But for the last few years, I have this mucus release tablet, and maybe I should have talked about this in the other portion, but I have these mucus relief tablets that I take pretty much daily, right? And they help me expect, if you will, it's kind of an expectorant for me and keeps that congestion out of my body. So my point to that is there such a thing as pre-medicating?
Probably not. There's not great, yeah. And what I always tell people about anything like, that, or people that take vitamin C or zinc or things like that, is if it's working for you, don't stop, because if it seems like it's working, then go ahead, especially if there's not any side effects from it.
Right.
But every time they try to do a true scientific study to find a supplement or a substance or a course of action that can reduce your likelihood of getting a common cold, it always comes up short. They're never really, I'm laughing. I just saw our friend from Blackout telling us that hey, even in the snow. I had a buddy from Maine who was like that. We'd be out shoveling snow, and I'd have a snowsuit, and he would stroll over wearing flip-flops. There's never been any great any particular substance or course of action that's been shown to consistently reduce people's likelihood of getting a cold, with one exception, and that is washing your hands. So the folks that are fastidious about washing their hands after shaking hands or touching doorknobs or things like that, they actually have a much lower likelihood of getting colds than folks that don't do that. And that's one of the reasons why when I'm at work, the first thing you do when you walk into a patient's room is clean your hands with either washing your hands or hand sanitizer. And then as you leave the room, after I've touched the doorknob, before I go back to my office, I'll do the same thing again. And that has been shown to help. But there's a direct reason for that, because you're potentially killing the virus off on your hands before you wind up touching your face and causing the transmission. Right. But taking vitamin C and zinc and all those sort of things have not been shown to be particularly helpful.
So it's more about passing the germs on and basically keeping your hands, clean, because you obviously touch a lot of things. Or obviously if you're sneezing and stuff, that's another thing. But it's more about, I guess, like you said, just kind of keeping your hands clean.
Yeah, and then the other thing too, especially for athletes, is watching the overtraining and making it. Like I said, I don't like the term overtraining. I prefer the term under recovering, because it's not that you're training too much; it's that you're not giving yourself enough time to recover. But if you're really pushing it sort of towards the peak of your intensity in camp, it's important to make sure you don't push yourself too far, especially during the cough, cold, and flu season, right? Because you certainly don't want to be a week out from your fight and start getting a fever and get a cold, wind up having to fight when you can barely breathe in the first place.
Yeah, I wanted to go ahead and put that question up there that we were kind of going into is about germs. A quick story, and I got a story, right? But when I was in California, I never forget it. The man taught me a valuable lesson. I think he taught me a valuable lesson because it certainly changed my attitude. There was this homeless man, and he was at McDonald's. And I went up to him, and I said, hey, man, he was digging in a trash can, right? And I said, man, come on, don't do that. Let me buy you some food. Let me buy you a clean burger and this, because there's all these germs are in this trash can that can't be good for you. He looked me right in the face, and I've never forgotten it. He said, germs are overrated. Now, since that time, I have picked things off the floor and eaten them, right? I have done things a little bit differently because I'm still here, and if germs were that devastating, I mean, we would probably all be dead. I mean, well, what's your thoughts on that?
Yes, I mean, it depends on the germ. So,
Okay.
whenever the problem with a story like that, or it's just like people that say, I've always done whatever and never
Right.
had a problem. There's a selection bias in that, because the folks that, like, suppose that eating stuff off the floor was deadly 1/5 of the time.
Right.
You telling me that you never had a problem, but the 4 people who picked up the burger off the floor died aren't here to tell us their story. So there's a little bit of a selection bias when you hear,
Right.
historical stories like that. But I mean, the fact of the matter is, yeah, I mean, anybody who's had kids, you have kids, you know this. God, how many times did you catch your kids when they were
Right.
toddlers eating
Right. Right.
off to my left, I've got my German Shepherd's food. I couldn't keep my son out of that. I joked for a while that I was going to save money just feeding him dog food instead of people food, because he seemed to strongly prefer it. And I
Right.
mean, there's got to be all sorts of germs in the dog's bowl, because you feed him, he eats out of it and then walks away, and then it sits there for 10, 12 hours.
Right.
But the sort of benign kind of germs that are in most dirt and things like that are probably not a big deal. But there are definitely germs out there that are a huge deal. So eating things that have hit the floor, your likelihood of picking up fecal bacteria because somebody walked outside and stepped where a dog had just peed, or went into a restroom or something like that, and then came out, and there's potentially bacteria there that could give you very significant food poisoning.
Right.
There's like botulism and other diseases that kind of hang out in soil that you can get exposed to. So the idea that, as he said, germs are overrated, that's one of those things that's kind of true but not true. So
Right.
people will freak out when something touches the floor, if they see somebody eating something that touched the floor, as if it's definitely going to kill them if they eat it, which is not true. But the likelihood that something that's touched the floor or something like that that's not clean is going to make you ill, possibly very significantly ill, is way higher than something that's sanitary.
Right. Right. So what we want to do right now is, as we are getting ready to close out here just for a moment, that I want to talk about some of the preventions, and you've already mentioned some. But if you can just go back through as we wind down here to give people some ideas of the best ways to prevent themselves from getting a cold.
Sure. So again, tailoring is kind of to athletes to say that the first and most important is practicing good personal hygiene. So make sure that when you're around somebody who's sick, or after you touch doorknobs or surfaces in public areas, particularly like, when you go to the supermarket, or if you go to a doctor's office, places where there's lots of people that have touched the same surface, make sure you sanitize your hands somehow, either with soap and water or hand sanitizer, before you touch your face.
Okay.
And I would try to get out of the habit of touching your face real frequently. People that wear glasses in particular, a lot of times are, always up to, sort of as a nervous habit, adjusting their glasses. Or
Yes, that's me.
sitting like you or I do all the time, where we sit like this,
Right.
bring your finger up. Try to get out of the habit of doing that, or at
Oh,
least make sure
I'm sorry.
sit on your hands, right? Yeah. Get out of the habit of doing that, because that's the most common mode of transmission. So, good hand hygiene is key. And then watch out for people who are clearly sick, and try to set the culture in your gym that coming to train when you're obviously sick is not a sign of being tough. It's a sign of being inconsiderate of your training partners.
That makes a lot of sense and everything. And I think that that is some valuable information. One final question about, do you recommend flu shots for people during this season?
Yeah, I do. I get a flu shot every year. There's lots of data that show that the people that get the flu shot have a much lower likelihood of getting the flu, particularly in years that the flu shot is well matched. And even if they were to get influenza, their chance of getting the serious complications that can lead to death and things like that, so pneumonia in particular, is much lower. So the science strongly supports getting an influenza shot.
Oh, very good, very good. Dr. Lucas dropping the knowledge today. We certainly do appreciate everything. I think it's going to help out a lot of people. And, again, fighters are always out there. They're doing their thing. Athletes out there doing their thing. And then just Us, it's just the general public are out here doing things, and we're catching these colds, especially this time of the year. And I think some of this information that was passed on today is definitely going to help some people out. As always, I want to thank you for taking the time. You know, this is going to be an ongoing series that we want to come on from time to time, and we're going to pick subjects. We're saying once a month, but maybe it might not be once a month, but we're certainly going to pick some really important subjects like this, and we're going to have these discussions because I know hundreds and hundreds of people will watch this video, and it's going to help somebody. And that is what Johnny Davis Live is all about. You know, we call it real talk or real solutions. Dr. Lucas, thank you so much for being on the show today.
Thanks for having me. Glad to do it.
All right. Thanks, sir. We'll talk to you soon.
Yep. Bye now.
All right, bye-bye. All right, ladies and gentlemen, there you have it there. We were speaking with Dr. John Lucas. He's out of Simpsonville, South Carolina, giving us some vital information on how to protect ourselves from the common cold and the flu. Really, really important information. Okay, guys, we're getting ready now for our second show at 1 o'clock with Mr. Jerome Robinson on abduction safety. It's going to be really, really important issue. A lot of that stuff's going on right now. We want to always thank everyone for watching Johnny Davis Live, guys. You can check us out on Facebook here on Johnny Davis or AK Promotions. You can also subscribe to our YouTube channel, Johnny Davis Live, as well. As always, guys, we want you to always respect one another. Forward march. This is Johnny Davis Live, and I'm checking out. See you in a few moments. Bye-bye.